Hello everyone, I'm Richard Caroline and today I'm here with Tina. We are from IILT. So we are back with another OET speaking session. In today's role play, we are dealing with a patient who accidentally got a rusty nail lodged in her palm and she's really worried about it. So she's being stubborn that she doesn't want the nurse to remove it and she wants a doctor to do it. So let's see how the nurse will be convincing her to remove it.
Yeah.
So here Tina will do the role of the nurse and I will be the patient. So let's get started.
Yes.
Alright, so you have 3 minutes time and you can prepare it.
Okay.
So your time's up. You ready?
Yes.
Start speaking.
Good morning.
Morning.
My name is Tina Thomas and I'm the registered nurse working in this accident and emergency department. How can I help you today?
Well, hi there. My name is Susan and I'm here because I accidentally got a rusty nail in my palm and it's really painful and I've been waiting here for quite a long time. So I would like to see the doctor.
Don't worry, Susan, and you have come to the right place. You told me that you are having a rusty nail that has been lodged in your palm, right?
That's right.
Okay, so do not worry. I will talk to the doctor and I'll see that the doctor comes and sees you fast. But before that, may I ask you some questions? Because I need to tell the doctor about your current situation, right? That's
Will
right.
it take a lot of time?
Not much, no, Susan. It will just take a very minimal amount of time. If you don't mind, if I ask you some questions, if you could just tell me, then I can tell it to the doctor. Yes?
All right then. Go ahead.
Okay. So, do you have any ongoing medical problems?
Yes, I suffer from type 2 diabetes and I actually see the doctor here.
Okay.
So that's the reason why I'm insisting to see the doctor.
Okay. So, it's been how many years that you're diabetic?
For about 3.5.
3.5. And what are you taking for your diabetes?
I take insulin for
You
it.
take insulin for your diabetes. Okay. So, you told me that you have a rusty nail that's lodged in your palm. When did this nail got lodged in your palm?
Today morning.
Today morning, and you came immediately over
straight
here.
away, yeah.
And then you had to wait here for some time.
Yes,
And I'm extremely sorry for you to wait over here. The thing is, because it's an accident and emergency department, and today we had a lot of patients over here. That was the reason why we kept you on hold. I'm extremely sorry for making you wait so much, okay?
All right.
Okay, so what we can do now is rest is assured, and what you need to do is, like, what we are going to do for you is now we're going to pull out the nail for you. If it is okay, may I?
Well, see, with all due respect, I'm not very comfortable with you doing it. And as I told you that I'm a diabetic patient and I see the doctor here, it would be better if my doctor can come down and he can do it by himself.
And could you please tell me in detail why wouldn't you don't like us doing it?
Just because I'm not comfortable
Okay.
and I don't want any complications to happen, because the doctor mentioned that being a diabetic patient, if you get a wound, it will take a lot of time to heal and complications come along with it. So I don't want any certain complications to occur. I'm not saying that you're not equipped to do it, but I just need a peace of mind, so that's the reason.
I certainly understand what you're going through. See, if I was in your situation, and I would have felt the same way, okay? So first and foremost, let me tell you, what you said is absolutely right. The doctor did say, and for people like you who's having diabetes, can cause a lot of complications. But if you're going to have this nail in your palm for some time, you know what can happen? It can cause a lot of problems. Can I tell you what are the complications that can happen?
Well, our conversation is taking a lot of time and it has to be done, you know, we have to act immediately, so it would be better if you can contact the doctor immediately.
Yes, I have already informed your matter to the doctor and I have told him, but the thing is, Susan, the hospital and this emergency department is quite busy today, and the doctor is with a very emergency situation. He's dealing with a life-threatening case. So it will take at least 10 minutes for him to come and see you. So he asked me whether I'll be able to pull out the nail, and you said that you need the doctor itself to come and pull it out. So I just wanted to make you understand what could be the complication of having a rusty nail lodged in your hand for more than 10 minutes. So that is what I thought. I'll just tell you what could be the consequences behind it.
Okay.
Okay, so actually if you have this nail lodged in your hand, you know, there can be a chance for infection. Not a small infection, you can have a major infection and you will need a high-end antibiotic for it. And then it will take a longer healing time, and then sometimes even if it doesn't heal, then we'll have to think about amputating it, and which is very difficult situation for anyone to face that, right? And then what we can do now is I can provide a local analgesia so that you will feel that area completely numb when we are going to remove it. And rest assured that the thing is, we we are going to clean that area in a very strict and sterile manner so that there will be no chances of any infections that's going to happen. Yes?
All right, yeah.
Okay. And another one more thing is we're going to give you some antibiotics for healing, so the healing process also will be faster. Yes? So may I remove the nail from your palm?
Well, are you sure that you can remove every bit of the rusty nail from it and leave nothing leading into any infection or complication later?
I definitely reassure you that nothing is going to happen for you, and I'll see that all the traces of the rust has been removed from your palm, and after that the doctor will be coming and seeing you, because he just asked me to remove the nail, and he'll come and see you and he will see what can be done, and he will again examine it, and then only we'll be leaving you out from here. Okay?
All right, sounds
yes.
like a good plan to me.
Okay, and then Susan, I would like to tell you something more about this diabetic care, what you need to do in your hand. You need to keep your hand clean and dry. Will you do that?
Yeah, I will.
Okay, and then you need to come for everyday wound dressing. Okay, and then you need to take your medicine at the right time.
Sure.
That the doctor will be telling you which medicine you need to take at what time.
All
Okay?
right, yeah.
Yes, and do you have anything else to ask me?
That's all?
Yes, and I would like to see you after a week. Will I?
Yeah, sure.
Okay.
I'll come.
Okay then. Then no more, nothing much to say. Don't worry, you are safe. I'll just now remove your nail from your palm, and then we'll see what the doctor has to say, and then you can go back home. Okay?
All right, thank you very much. Okay, so that's about 5 minutes. Thank you very much.
Okay.
Hello everyone. So just now we saw a role play which was really interesting, where we are actually dealing with a stubborn patient, and Tina was trying really hard to convince a stubborn patient. So you might also face some difficulties when you get some cases like a stubborn or a reluctant or agitated patients. So let's see how we can easily pick out the keywords and create sentences using these keywords in the role play. Let's get started. So let's see the first task. Begin with warm greetings and inquire what happened, any ongoing medical condition. So let's jot down the keywords here. Warm greetings, inquire what happened, ongoing medical conditions. So yes, when it is warm greetings, you can definitely start with a normal way of greeting, and then I'm going to show you how to do the next part. So here you can start by saying hello, good morning, and you can introduce yourself, and you can greet her, and you can ask her, how may I help you? That is, inquire what happened. And you have to also ask any ongoing medication there. So now let's see how a complete sentence can be there. Okay, so if this is me doing as a nurse, I'll start by saying, good morning, my name is Richa, and I'm one of the registered nurses working in this emergency department. How can I help you today? So she is explaining her requirements to me. So just make sure when a patient tells you her concern or what is the reason for their purpose, the reason for their visit, you have to provide an assurance there. So here she is telling me she's having a rusty nail lodged in her palm and she's here to remove it. So I can say, oh, I'm really sorry to hear that, but don't worry, let me look into it. And before that, before proceeding further, I would like to ask you some questions, whether you have any ongoing medical condition. So now let's complete the sentence together. Good morning, my name is Richa. I'm one of the registered nurses working in this emergency department. How may I help you? I'm sorry to hear that, but don't worry, let me look into it. Before proceeding further, for my better understanding, I would like to ask you one question. Do you have any ongoing medical condition? So this is the completion of task number 1, using the keywords which is mentioned in the task. The second one, reassure her it's going to be all right. Need to take the nail out. So the keywords will be all right. Take the nail out. The sentence. I reassure you that there are no complications right now and you will be perfectly all right. At the moment, we need to take the nail out. So shall I proceed? Simple as that. Third task. When she is reluctant, tell her if not removed, it might cause severe complications, infection, long healing time, even amputation. So here in the first task, we asked her whether she has any ongoing medical condition. So from the cue card, we can see that she is actually type 2 diabetes patient. So she will definitely say that, yes, I'm a diabetes patient. So here we have to use that information too. Now let's jot down the keywords. Reluctant, very important to note. Because when the patient is having an emotional side there, you have to actually give more importance to that emotional side. So reluctant. not removed, severe complications, and you have to mention the complications given in the bracket. So let's see how we can create a sentence there. I understand your reluctance. However, I have your best interest at heart. If the nail is not removed right now, it can cause severe complications, especially you are a diabetes patient, so it can cause infection. The healing time will be longer, as well as in severe complications, it might even lead into amputation. So I hope you understand the severity. So this is how you can create a sentence here. The next task. When asked, tell her the doctor is busy and will take time to come. Cannot delay the removal, should act fast. What are the keywords? Doctor, busy, take time to come, cannot delay the removal. So here you can actually give more importance to doctor being busy and cannot delay the removal of the nail. So let's look into the sentence. I understand that you are not comfortable with me removing the nail for you. However, the doctor is currently busy attending to a critically ill patient. And it is very important that we do not delay the procedure because it will cause complications in the future. So we need to act immediately. I hope you understand. This is how you can create that sentence. The next one. When the patient is adamant, politely tell her local anesthesia will be administered and antibiotics will be provided to quicken the healing. So we're trying to convince her when she's not at all ready to let the nurse remove the nail from her arm. So here we are trying, the keywords would be local anesthesia, antibiotics, quicken the healing. So when you create a sentence, just make sure these three words are there. So you can say, I can sense that you're not comfortable with me removing it, but I'm only trying to help you here. Miss Susan, I can help you here with providing a local anesthesia so that you will not feel any pain. And after that, I can administer you antibiotics. It will help for the quicker healing. So the main three keywords are included in the sentence which I created right now. Next one. Advise her to be very careful with wound care as she is diabetic and there are high chances of infection. In brackets, keep the area dry and clean, regular wound dressing, medicine at right time. So what are the keywords here? First one, careful, wound care, diabetic, chances of infection. So these are the four main keywords, and the information given in the brackets would be additional information which you are supposed to inform the patient. So let's see how we can create a sentence with these info. So you can say, I would like to tell you about how important it is to take care of your wound because you are a diabetic patient. So there are high chances of infection. So make sure to keep the area dry and clean with proper and regular wound dressing and medication at the right time. So these are the key elements, how to create the sentence using the keywords given in the task card. The last task. Reassure she will be all right soon and ask to come for a review in 1 week's time. So the first thing is all right soon. The second keyword would be review 1 week's time. So when you give that reassurance, if you want, you can give a little more of a detailed explanation about her condition and the suggestions that you have provided and what she has to keep in mind. And then you can inform her about the review that she has to come back to you. So I'm going to create a sentence right now using my way of addition of the sentences. So I'm saying like, Miss Susan, I reassure you that everything will be all right very soon. If you follow all the instructions, there will not be any complications. And also, it is recommended that you come and meet me after 1 week's time. So I have included the key elements there. So this is how we do it. And especially I want to tell you one thing is because here we are dealing with an adamant patient who is not comfortable with the nurse. She wants the doctor. So just make sure that you provide a lot of reassurance and just make her comfortable and make her feel like a nurse can also do things in a better way. So she's safe with you. So you just need to make sure that you use a lot of good reassurance statements in between these tasks. It will be easier for you. So that's all with this task card. We'll come up with next one. Until then, keep watching.
IILT, it's my cup of tea.